Once Candida auris has been introduced into a healthcare facility, it can easily spread. Outbreaks have been reported at a number of hospitals and nursing homes. Healthcare facilities and providers in Pennsylvania should consider screening the following patients who are at high risk for Candida auris and place them on preemptive transmission-based precautions while awaiting test results. Healthcare contacts of those with newly identified Candida auris infection or colonization. A patient with clinical risk factors for acquiring Candida auris, including one or more of the following: patients who are on a mechanical ventilator or have a tracheostomy and reside in or are transferred from a long-term acute care hospital or a skilled nursing facility with the capability to care for residents on ventilators. Patients who have had an overnight stay in a healthcare facility outside of the United States within the last year. Patients infected or colonized with carbapenemase-producing carbapenem-resistant Enterobacterales, or CPCRE. Co-colonization of Candida auris with these organisms has been observed. After a patient has been tested for Candida auris, the next step is interpreting the test results. Clinical and reference laboratories may have different capabilities for identifying yeast and confirming Candida auris. Here's what you may see on a laboratory report. First, let's look at a urine culture. These results show that a yeast has been identified from a urine specimen. However, the isolate must undergo further identification. The yeast identified from the patient's urine can be a number of different organisms. So if you are awaiting results on a high-risk patient, you would need to continue preemptive transmission-based precautions until further identification. Now, let's assess a wound specimen. The results show that a Candida species is growing, but it can be one of several possibilities. So once again, if this is a high-risk patient, keep the patient on preemptive transmission-based precautions until you know more. Lastly, we have a blood culture. Candida auris was found in the patient's blood, and more specifically, in a sample collected from a central venous catheter. In this case, from a left peripherally inserted central catheter, also known as a PIC. Therefore, this patient would need to remain on transmission-based precautions indefinitely. Candida auris was made a nationally notifiable disease in 2018. In Pennsylvania, healthcare facilities and laboratories are asked to report cases of Candida auris into PA NEDs within 24 hours. Report cultures from all body sites obtained for diagnostic or surveillance purposes, including but not limited to blood, wounds, skin, urine, and respiratory secretions. To discuss cases of Candida auris or ask questions, contact your local health department or the Pennsylvania Department of Health by calling 1-877-PA-HEALTH. Laboratories should ideally hold Candida auris isolates for at least 1 month. Further testing may be coordinated by local or state public health as needed. In addition to reporting new cases, you should also notify your local public health department when a patient or resident who is colonized or infected with Candida auris will be transferred from your facility to another inpatient facility. This allows public health to work with the receiving facility to provide education and ensure that they are prepared to implement appropriate infection prevention and control measures. It's important to quickly identify and track Candida auris, so healthcare facilities can take special precautions to stop its spread. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/caurisvideo. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.